Hi, good afternoon, everybody. Welcome to the 14th edition of the Health System Fix podcast. Ishra, I'm a child, adolescent, and adult psychiatrist and a health systems expert. My goal through this podcast is to talk to people who have impactful professional and personal experiences in relationship with our health system, who have often worked on innovative solutions and have ideas that I find really interesting. I'm very excited. Today, our guest is Veronica Dela Rosa. She's the Executive Vice President of Operations at San Ysidro Health. She provides key oversight on strategic initiatives of clinical operations, information technology, population health, and performance, excellence, compliance, HR, pharmacy operations, and belonging initiatives. By the way, I can vouch for all of this because we worked together for about 6.5 years while I was at San Ysidro Health. I definitely saw the impact there. Veronica has over 25 years of healthcare experience. She spent more than 20 years as a healthcare administrator at Kaiser Permanente, where she oversaw the medical group's primary care services division and was focused on innovative healthcare delivery for over 600,000 patients. It's a pleasure to welcome you, Veronica.
It's a pleasure to be here, and thank you for welcoming me on your podcast, Dr. Mishra.
Please call me Gaurav.
Gaurav.
Yeah, great. So, Veronica, one of the things I'm interested in is learning about our guests through their life journey. So, can you tell us a little bit about what was life like till you first start thinking about college or work?
Yeah. So every month we have a new employee orientation here at San Ysidro, and I always love to share where I started, my humble beginnings. Not too far from the headquarters here at San Ysidro, there is a high school, Montgomery High School. I am a graduate of that school. And in the early years of high school, my father passed away when I was 16, so I really had to get into the workforce. The trolley led me to San Ysidro Health. A couple of people who suggested I come check out this clinic. I was looking for a job. I needed to help my mother. And so the trolley right across the street led me to San Ysidro Health. And that is where my healthcare journey began. I had no clue where I was walking into other than they were an agency that helped the community. That's all I knew. And so I volunteered for 3 months because I had no skill other than high school. And then that 3 months became a reception job. At that point, the CEO would interview every single employee. There were less than 200 back then. And I was really privileged to work with that CEO in the 11 years that I remained and advanced at San Ysidro Health.
I did not know the story of the origin. I do remember us speaking, a few years ago when you said, once you're at San Ysidro, it stays with you.
Yes. So if I could just elaborate, I was put in reception, which I thought for me, in reflecting kind of when you ask these certain questions and the time and the season of my life now, that was probably the best place to put me, because I didn't understand what empathy was until I was living it. So I had a pretty sad story, right? My dad passing away, my mom having to go into the workforce when she was traditionally a stay-home mom. But the stories, every single person that I would register shared why they were there, my kindness to them, my empathy just became overwhelmingly more than me. So it was really where I fell in love with helping others. I knew that that's what I wanted to do in some form.
Let me ask you about empathy, because I think sometimes in healthcare, we don't even have empathy for ourselves. Do you think that experience also helped you with that, with having some empathy and kindness for yourself?
Absolutely. I think it helped me heal in so many ways. I was around healthcare professionals. They would tell me, they would hear my story. I would just share it, and they would say, "Oh, have you received counseling? That must have been a traumatic experience for you." And when you're living day to day and you don't realize that you need to pause and check in and provide that self-care, it did start early for me, but not because I knew it. It was because people around me introduced the concepts that I was so willing to embrace.
We could talk a little bit more about the San Ysidro culture itself. Prior to San Ysidro, I was at work for the Imperial County, and it is an incredible learning place. I liked working there. And I think I told you this a while back. When I first started San Ysidro, it was a new job, and the culture of the grassroots, to me, probably took a year and a half to really start feeling it or starting to live it yourself. What was that experience like for you?
Yeah. So we were much smaller, that we only had the headquarters and then 3 other satellite clinics. So the culture was easier to embrace when you have a full staff meeting. Imagine having a staff meeting with all your employees, the beauty and the luxury now when we're so large, and conveying how important sharing employee of the month, highlighting how we help people through our social services, through our physicians, through our reception. It was a celebration to really bring the examples of what the mission we were living. And it was coming to life quicker because we were so small. And I think now part of our challenge is being large is how do we still connect with the mission, which I know we have. But it's just really bringing these micro celebrations about what we do, how we do it, catching people doing the right thing, recognizing them. I'm bringing a lot of concepts from Kaiser to San Ysidro. That was a big, large institution that managed to do that well, but it was bite-sized, consistent, you know, recognition, reward, fueling leaders. And that is something that we need to continuously do so that we're always highlight the work and having every employee here know how they touch and are contributing to the mission of San Ysidro.
Can you tell us a little bit more about your work at Kaiser?
So, after 11 years here, I started as a high school volunteer. 11 years, I'm on my way to Kaiser. And the same CEO that mentored me, really fostered that whole 11 years, warned me a little bit about what I would see outside of the organization. He said, maybe I'll be the only one that looks like me around the room, that I may have to work harder to prove myself, that I had been in some ways comforted in an organization that was minority organization. So I almost think now in reflection, he was preparing me for like a culture that I was not ready to be in or that I didn't know about. And at first I didn't see that. So my first job at Kaiser, it was the first management job was in the EVS department, environmental services. I had never, ever been in a role where housekeeping and all of the environmental services division reported to me. But it was a management job that I wanted to challenge myself with and go into Kaiser. That was the only thing. I had a colleague of mine at Kaiser. She said, it's a good entry. That was a director position, but don't stay there too long. Kaiser has a way to box you in when they see that, that's your job. So I go into Kaiser in a job that I had to convince in my interviews that I could transfer my skills, my people skills. And I was really, really good. And the connection to the people, those were the comforting pieces that I thought San Ysidro mimicked. These were mostly minority staff that some of them didn't speak English. I remember looking at their tools, which would be vacuums and dust mops, and the vacuums were duct taped and they were old and heavy. And I remember going back to administration and asking for a budget that I needed to equip the team with the right tools. So even though I didn't know EVS, I knew that staff need their tools to do their job. Those were the transferable. I remember getting those shipment of vacuums and I personally delivered them in my car. My VP said, no, we can have the truck deliver them. And I said, no, you don't understand. I want to deliver because they're going to now have a promise to do their job to the best of their ability. And that to me was a learning opportunity. And also I engaged that staff at Kaiser to a level that they had not been. I educated them on how many people are seen in an exam room. They clean the room and it's empty at night. But do you know? So again, touching the commitment to their mission. They didn't know. They just come in and clean. And I said, do you know how many people you touch because of your cleanliness? Because if it was your mother or your sister or your brother coming to an exam room, and instilling the pride in people and what they do. And I was able to really do a very, very good job. A year later, then I go into OBGYN. So I run OBGYN from being environmental services 1 year to now running OBGYN, maternal child health, for 6 years. From 6 years, I went on to the business office. And then from the business office, I went on to until I was on the C-suite for the last 5 years there at Kaiser. But those words that the CEO had reminded me that I'll be the only one sometimes in the room. It started when I started elevating in that high middle manager. That's where I remembered his words. That's where some of the teachings that he had told me so many years past start coming to life.
The story that you tell about delivering the vacuum yourself is so critical because we know healthcare cannot be done by one or two people. It cannot be done by a doctor. It cannot be done by a nurse by themselves. There is probably 10, 15 people that are responsible for one patient to get seen, and they have touch points. And oftentimes, we don't always do a great job of making sure all team members know that they have an impactful role,
Yes. Yes.
and we focus too much maybe on the front line, the clinical team, but everybody together has to be putting in their effort for it to actually take place and for it to be done well.
I've challenged people to believe more than of themselves. And that was the beginning of kind of really putting that to practice outside of San Ysidro. When you know someone and you believe in someone and you tell them that they are capable of so much more, all they remember was, back to that EVS, they were a team that only was reactive to complaints. So I would come back and say, you did a great job. And I would solicit to the managers because again, I was a manager in operations prior to that. I had the communication skill to really make sure that people were rewarding, not just when there was an issue. And so that was also a change in mindset for the leadership at Kaiser to really respect all of the staff members equally, that we all have an important job and none of it is more important than the other when we're really managing people. And so, yeah, I started planting those concepts there.
Thing critical, I think, is sometimes through our career journey, because I think if you're going from clinical operations to overseeing EVS,
Mm-hmm.
a lot of people may find that tough to transition. Obviously, I think your vision is much longer term. I think you're looking at, sometimes I'm doing things which are very important, but I'm not very excited about it, or it is not my long-term plan, but it is an important way to kind of keep progressing.
Some people told me that that was a big risk, right? From a career that I was already at a community clinic running 3 satellite clinics. But part of the challenge was here at San Ysidro, we were so small. There was no more pipeline. I was going to be there for a bit, and our CEO was aware of that. So this is where he became more of a mentor than a former boss, because he knew I needed to challenge myself for a while. And when this opportunity at Kaiser came, I thought it through. I was nervous, to be honest, but I knew that I had people skills. And I said, if I'm transparent and I say, I don't know how long it takes to wax this floor, show me. And they would, with pride, show me how long it took, because then I would average kind of the workflow and make sure that I was aware of how much they could do. I was bringing their information so that I could help manage them. And the seniors, there was senior leaders there in the EVS, and I brought them as well and said, what do we need to change here? We want to make sure that we show pride in the work that we do. You're not invisible. Sometimes it looks like it is if you're the night crew, but you're not invisible.
I was just talking to a young leader who was asking me about, how do I get this agenda done? How do I get people to see it? I said, your first job is to ask people who report to you what their agenda is. What are they missing in their everyday work to be able to do really good work? And then that really reframed it for her to see that, okay, it's not just about what vision I have, what I want to get done. It is like, I need to talk to the team and see what they need.
You get their buy-in, you get them, they know their jobs. Our job is to make sure we remove barriers and keep them engaged and have a purpose for what they do each and every day. And that was, again, something that to this day, I still see people from those teams that reach out to me.
Yeah, because you had an impact. The reason I really wanted to speak to you is that we've had so many interesting conversations about leadership and the work we're doing. It definitely has an impact on me. Now, you went on this path of growth. How did you keep? How did you invest in keeping your leadership skills up to the new challenge you were going to face?
So here at San Ysidro in my early years, probably, again, that CEO that took interest in kind of what are you going to do with you? What career? Nobody had asked me that. Not even my high school counselor had asked me that. And so it was the CEO there, Mr. Arce, back in the day, who brought solutions. There was about 4 or 5 of us in the same situation where we didn't go the traditional route to college because of our family circumstances. But that didn't keep us from continuing our formal education. So by the time I left here, 11 years after, I had my master's degree in business administration. And then soon after Kaiser, I do have to say, that if I could take something from Kaiser and bring it here is really the amount and the level of resources that they place in leadership. It is available, it is beautifully done, and it is something that I really gravitated to. So any conference or any series that was offered through the Kaiser leadership pathway, I would sign up. I would be very intrigued. And then it was really bringing it back to the teams and learning and showing our teams what I've learned. And I've always been someone who wants to manage and share, very transparent, because keeping knowledge to yourself, it won't serve anyone, not even yourself at some point. So I was fortunate. I was many, many trainings, 3, 4 times a year, to the point that at some point, some of our leaders were like, "Oh, another training." But now when I look back, this is the part that we need to infuse ourselves in this organization.
Yeah, because there is so much growth that's needed, and especially if you're trying to step into leadership, it is really a responsibility to learn the new things, learn the new roles you have. Even medical training teaches you how to be a doctor, but unfortunately, many times doctors assume they know everything about everything, which they don't. And a lot of learnings need to happen on how to manage a big team or how to be a leader. That's a different skill set than being a clinician.
So we've brought in some trainings, and we're also looking at the skill set for every job. And then how can you advance from where you are if you're interested? What are the pathways? What are the skills that are needed? We're starting to do some of that work, making sure that we're going to be able to see a retirement pathway here. We're 3,000 employees with much more growth than my first time when I was here. And my goal is to have those pipelines and you see yourself advance and that we invest in our leaders.
So you come back to San Ysidro as an executive vice president. So what is that experience like for you coming back in such a, you had not jumped a couple rungs, you had jumped, essentially there were no more rungs to jump once you came back. So what is that like?
It's interesting, Gaurav. I took a risk leaving San Ysidro, right, to the EVS, and then my 21 career. And then I'm at the C suite about to really launch to the next level when this opportunity came. So my colleagues at Kaiser were shocked that I was saying goodbye because they didn't understand where I came from, right? They did not understand the history that I had and where I felt my growth at the most vulnerable time of my life. San Ysidro was here for me, shaped me, groomed me. I go off 21 years. I can continue on the path to Kaiser or this one job that came. And I was really um, nervous, but I knew in my gut that it was the right move for me. So I come back, and of course, very different. A few people are still here from the time that I've left, but many not. But what did stand out is the mission work was still here. The people were committed to, improving the health and the well-being of the communities we serve with access for all, and that didn't change. And so it was I knew it was the right thing. It was the intuition that I knew I was in the right place at the right time to come back in this session. I remember walking back to San Ysidro, the original health center, and some things aren't there anymore, but the reception is the same shape. And it brought me back to when I was sitting on the counter, making sure that these patients got what they needed from whatever I could help. And I still come back to that because this is more than just a job.
Yeah, I think I think this important to highlight some risk taking appetite also.
Mhm.
I have just recently sad that I left San Ysidro, but recently when I was trying to make that decision, and I was obviously hesitant because, I love the organization, love to work, love the team. And then I had to talk to myself that the only reason you even have the current San Ysidro job is because you took a risk.
Uh-huh.
Like you, I had to sell myself as a leader, and I was a budding leader at best, but I think I had to really sell myself as like this, I can do this. And then once I had the opportunity, kind of try to rise up to it. But at the same time, to remind myself that very risk, this same risk that you're trying to take now is the one that even got you to this position. So it worked out last time. Maybe, maybe it'll work out again.
And at some point, you know in your gut that it is the next step for you. Sometimes that intuition is very much part of that leadership piece where you balancing who you are with your expertise and what you can offer and where you want to see your passion, right? The passion fuels purpose, and I think you find that purpose and it fuels your passion. So it's like a kind of a circle.
So recently, I think I know that you stepped in the role of the interim CEO at San Ysidro.
I did.
So at that level, once you're at the executive suite, I'm curious to know, you went from, you can call it the number two job in the organization to the number one job, just hierarchy. I'm not talking about like importance. Did you feel a change in landscape of what you had to oversee? What was that change like?
Yeah. No, I have been in this role for 7 years. So that helped, right? Because part of what my coming into this role was to really help the CEO lead and kind of manage. So bringing in VPs, I'd been part of the restructure, kind of managing at that level. Always thinking, gosh, maybe one day that will be me, right? The whole point of being number two is that at some point number one may be a possibility.
Yeah, yeah.
So, and all that I've done, I've really done it from a very, very broad change so that we're moving San Ysidro to be here far longer than any one of us. How do we sustain San Ysidro? How do we look ahead? So that vision of always looking beyond today has been here from day one. So, but what I do know that it's different when the whole decision is on your shoulders and you're now closer to the board of directors who really lead this organization. That was probably the biggest change, that it's a direct line to the board and that the decision making is really, it ends with you. The buck stops there. So I can appreciate there is a responsibility that's different from number two. And that really is that you are leading this organization. There's no buffer other than you and the board. So rely on your teams, have good talent, have a good strategy. Like there are things that you put in place so that when you lead, it's not a fear. It really is as a confidence about where do we move forward.
It's so critical. I think the having a team you can rely on and you can trust is really a game changer. And then knowing that that team is really going to help you do the work that needs to get done, you have to make a lot of tough decisions. And at the end of the day, the buck stops with you. I guess if you act that way or are that way, then the team has a little more freedom to actually then do it.
Yeah.
They know, okay, Veronica's got this. So
And our data, right? So we're evolving as we go with our technology and better decisions with better data. And so as we evolve and gain a little more insight to the path we're going to take for strategy, the more that we're aligned. So two things since I've gotten here in 7 years and I continue: horizontal alignment, where we all are aligned with big vision so that there's complementary decisions and not silos. I believe you were here. Sometimes we create silos because the way that our funding structure is. And so we have to acknowledge that those are barriers that we can create and we can realign. And so that's been part of the trajectory that I've seen since I've been here, is really aligning horizontally and vertically, and that we're a little more cohesive in how we can be nimble and pivot when we need to.
and silos, I think, are almost natural. It's not that it should be that way, but unfortunately, I think the way our system is set up, silos, you have to have an anti-silo effort. It is not just
Yes.
wanting the best doesn't result in no silo. You have to have active
Deliberate.
effort to prevent silos.
Yes, yes, very deliberate and making sure that when we're looking at new models of care or if we're looking at a new process, that we start unraveling that and not get, you know, put that as part of the equation. How do we streamline? How do we collectively manage this new workflow differently? And really bringing our leaders and our next level directors to understand where we're going and why it's so important.
With the CCBHC program, which you were supporting and helping throughout, I believe till date, and I know Dr. Oja, who's now running the show, believes it, is I think one of the things we did start from the beginning was have a weekly treatment team meeting with everybody, all hands on deck: addiction medicine, psychiatry, therapy, case management. Every single person who was involved in the team, sub counselors, was in that meeting. And just doing that prevents silos, prevents information leaking, and helps the team work better together. I know for sure that one meeting just makes the whole program run really.
I think when you equipped employees with the why, and that they're part of the solution and the work, that's where the engagement comes. That's where the fostering of ownership and accountability and excitement and the creativity that comes after, right?
That's the exciting part. I think once you've covered the baseline, now you get to be creative. Then you look at to do things which you had thought, I don't think we can ever get there, but now you can actually get there because you're ready. So let me ask you about value-based care. So I know you have a passion for it. We've talked about it also in the past. The way I see it, obviously, federally qualified health centers is the one that's closest to my heart because I think the impact we have is incredible. At the same time, the fee-for-service model is not necessarily the best model one has to live under. So I know you have some passion about value-based care. So the question I have is, what do you think is the biggest challenge FQHCs have in transforming to that new framework?
Well, I think in a capitated world, value based is really when your members are assigned to you. The model that we have now is that our patients can go anywhere at any time. So every federally qualified health center turns no one away. And that's a beautiful thing in the concept. But when you really try to manage value based, who's responsible for that life? And then how do you capture all the costs that that patient can incur outside of your system? So usually in the value-based non-Medi-Cal world, you're assigned to a plan and that's where you go. And that's where they coordinate your care and you kind of follow until the state can be able to manage that piece. It'll be interesting how we get to value based with the state model and with the health plans taking on a little more commitment. I don't know what it's going to look like. They've tried a couple cohorts, and because of that, the patient can go anywhere. The rates have come back too low for a federally qualified health center to be able to manage a patient. And that's because they didn't capture the full cost. They go out to other areas. It's fragmented in many ways. So you can't place value based on a fragmented model. So the model is going to have to transform to something different. I hear that there's a work group now at the state level trying to look at value based again, because I do believe, and others don't believe value based is the right approach. I personally have seen it work in the 21 years at Kaiser. You have to have your alignment with your priorities. Prevention is something that I'm bringing here. It's not a luxury. Prevention, we can begin now here. It doesn't have to be value-based. How do we get our patients to understand that prevention is part of healthcare and they have a right to prevention, and everybody deserves those early elements before. I always say your engine light is on. Don't wait till you have a engine problem.
That's a great analogy. I think you're so right that value-based care really requires a significant upfront investment for it to work. It cannot, you have to believe that it's going to work, and it will work, but you cannot do it piecemeal, especially in early steps. The long-term cost will go down, but the early cost is there.
Yeah. And the fee-for-service model doesn't allow you now to even invest in those things because you won't be reimbursed. So we're in this very tough crossroad that I think pretty soon we will get there.
I also do think there will be need for rethinking the clinical model we have. I think the payment model for sure, it's not sustainable. Even the clinical model, how I think we are too license heavy and less using of our support team, our nurses, case managers, everybody. One of the ways that CCBHC again became sustainable and successful was we were caring for really complex patients. Our case managers, community health workers, peer support, sub counselors, these are people who traditionally, unfortunately, the health centers cannot bill for, but are such critical pieces of that infrastructure of care that with that in place, luckily with grant funding, we were able to now build a system that we were able to care for a lot more complex patients.
And demonstrate the value, because I think the more we can demonstrate new models of care through the grants or however we can demonstrate, I think that we could then bring back our data. Integrated behavioral health, I know we've talked about it when you were here. It's beginning to form itself. We understand those are the needed subtleties, but really internally will strengthen not only our care that we deliver, but really in the cost structure that we need to be thinking about in the future. I'm forming a workforce of the future, Dr. Mishra, because our technologies are going to bring different jobs that don't exist today. and they might sunset some that are not going to be needed in the future. So how do we look ahead? What pipelines do we need? Well, those are part of those mentions that you made, where how do we build our models with maybe not so much license, or a licenses that doesn't exist now that we can incorporate and bring the group. We're testing a model now on bringing in a registered dietitian and then comparing that to how we deliver model through the health educator versus a dietitian, and in very specific environments. So, we have our research department that we're maximizing to really test models right now, including AI.
I mean, AI is such a powerful tool. One of the most exciting pieces is that as you're talking about the workforce for the future, I think there are so many problems in healthcare that have not been touched or not done well. There is a way to reimagine the new positions or new workforce solving those very old, age-old problems. I wanted to talk to you about your roles as serving as a board member on different nonprofits. When did you start thinking about your impact in the community beyond your work? Which obviously the work itself is a impact in the community, but
I was always on committees and advisories at San Ysidro, but nothing ever official. And it wasn't until I was leading OBGYN at Kaiser. Women's health, lack of the infrastructure for research in women, leading that organization for 6 years, that department. I was invited to sit on the board of Planned Parenthood. We had a contract there. At first I was hesitant, but then when I saw all of the barriers that we had, this is where the advocacy comes in, where you can't ignore. You get involved because you care. And I wanted to make sure that I was leading as much as I could. So I was on the board, and then I got on the national board from that work because I was about prevention, back to prevention. So we had a contract where we wanted to make sure that we were preventing unnecessarily births, and how can we prevent versus procedure. That was always kind of my goal there. And we were able to be very smart in how we contracted with them and making sure that unwanted prevention was first before anything. The national board was very interesting because then I see a scope from a whole national view. And I was on that board for 5 years representing San Diego. And then I was on a binational board down in Tijuana. There's a community clinic that's part of a network, and I was invited to be on that. And so that the binational work started there. And then Latino Coalition for a Healthy California as a state. That was really when the soda tax. So they were very famous, that coalition, for fighting for the soda tax, so that soda was limited in some of those low socioeconomic places where soda's cheap, but it's expensive to eat healthy. And so that soda tax was going to go back into these communities. And I'm still on that board. It's had some changes, but they've really done some advocacy work. And then I'm chairing the regional task force on homelessness right now. Unhoused, all of it has social determinants of health, even before it had the term. So our communities are the same, right? The same individuals that we see are the same individuals that have housing and food insecurity and childcare challenges. So when you're in health in our community, it's like a hub and spoke. There's so many other issues that are deterring them from their health. And so my job is to be selective in where can I make a difference from a leadership perspective and influence. And I've been asked to speak on panels. I'm on the advisory board for the president at Southwestern College because education is a pipeline. So those are the thread that ties all the work in so that we have healthy communities.
that's inspiring. My entry into healthcare was I wanted to be a doctor since I was 5, and that's all I wanted to do. And I was lucky enough to do it. And then medical school, unfortunately, it teaches you that you are the most important piece in the puzzle. And a few years into practice, you realize you definitely are.
That must be very humbling when you.
It's incredibly humbling. And then, I remember working with kids in Imperial County, and mom brings in her child with supposed ADHD, and he has six siblings, and he has all the textbook symptoms of ADHD. And then you probe the history, and you realize, 2 weeks ago there was a domestic violence incident at home. They lost their housing. 6, 7 kids and mom are in a hotel room. This kid has externalizing behaviors. History makes sense. There is no ADHD here. It is all environmental, all situational, and life events.
And how do you quantify that? How do you quantify that to make it real?
It is more real most of the times than the diagnosis that I've been trained to provide.
Yeah, yeah.
I'm working at the juvenile hall right now in Otay Mesa a couple of days a week. There's no diagnosis in the DSM that just does justice to what these kids' lives have been like. And sometimes at juvenile hall is the place they feel most calm at, which
Can
itself
you
is,
imagine?
which is sad. That's the place where if you and I were suddenly locked in there, we would be panicking, and they are calm there. And I'm thinking their life outside is so chaotic
That this is more secure. This seems more secure and stable.
and reliable. Yeah, I had a couple more questions for you. Your journey is so incredible. I think it would be helpful for maybe a high schooler or young person thinking about what are they going to do with their life, or especially if they think about healthcare. What advice would you have?
So I've had the opportunity to mentor a few college young ladies, a couple high school. I've been asked to speak to a few venues where the associations where young ladies come to me and want to talk to me. And I, of course, make myself available. And just yesterday, I was talking to a San Marcos University student who wants to think about analytics, and she wanted to know if there's analytics in healthcare. So I connect her with RVP and Sonia and Population Health. We have a great first connecting to what they want to do and the ideas that they have. Sometimes if they don't have any idea, it really is where do they want to begin? I came as a volunteer because I needed a job. It just so happens that it was a healthcare organization. And I always say, I was not looking for healthcare. Healthcare found me. And it could be that vague for someone or someone like you that you knew you wanted to be your profession as a young age. And there's so many things in between. But explore. Are you a front facing? Do you like the front? Do you like data? Do you like working with a team, working by yourself? Those are the things that I ask. Usually, when they're in college, they kind of have an idea what they've liked. The high schoolers are really, and middle school, where they're just exploring all kinds of information. I always say it depends on the age of whoever's asking is what is it that you like to do? What brings you joy so far in your life? And then sometimes it's exploring opportunities and saying, nope, I tried that, wasn't for me. Some people like to write, they could be grant writers in healthcare, or there's just always a skill that they like. And how do you overlay it into healthcare and different kinds of healthcare? Hospital administration, highly regulated. If you like structure and highly regulated. Not that we're not highly regulated, but hospital administration is much different. I had a little bit of that experience at Kaiser 2 years. And then I always say, when you first start, it really is about individual contributions. As you start moving your way up, it is really about leading through others. And how do you motivate people? How do you instill trust? And how do you elevate people by your belief in them? I think conscious leadership, how you show up, regardless of where you are, needs to be how you show up each and every day. And you lead where you are. I always tell them, you lead where you stand.
I was telling somebody the other day, all my life I've had female bosses, except for now when I'm my own boss. But it's not easy working for myself. And even while at San Ysidro, at least a few female colleagues and leaders, I told them, you got to get FaceTime with Veronica. As a mentor, as a leader, somebody to look up to, somebody to sort of talk to. If you have thoughts on women and senior leadership roles, and there are barriers even today, and like, do you have any advice for them?
I think we need to be better collaborators. I think that women who feel they're alone, that's at the worst time where you're feeling like it's only me. And I think collaboration with community, that is something that I'm going to be a little more. And one of the associations that I go are all women. And so how can we share our experiences? And I'll compare it to something that's happening now that I find interesting. Menopause is being talked about more than anything right now. And it's because women that are there that want to talk about it are like, we're going to talk about it. We're going to make it okay. And I'm just using that as an example, but I think leaders and the challenges that we have as women, we need to talk about it. We need to say it's okay. We recognize it. How could we come together and destigmatize kind of the silence that you're feeling alone. I think for the first time being more vocal about it and being okay to say, yeah, leaders. I have a couple of groups that are talking about the wage gap in women, and should we be mindful of that? Not just at San Ysidro, because I don't think we here have that problem from from the equitable part of the salary ranges, but it is an issue that is talked about. And how can we bring it to light to make sure that women aren't feeling alone?
Coming to the last question, what is the most challenging and the most exciting problem you're working on today?
Wow. Well, the most exciting so far is that we were published in JAMA, and I don't know if you've seen that, but we were published in the Journal of American Medical Association as the leading institution, the PI, in our retinal AI work that we did. And I am very, very proud of the research team. I challenged them. I knew they could do it. And this would elevate our talent. So, Gaurav, we have so much talent that people just do their jobs because they love what they do. And so as I'm looking at this talent and I'm seeing opportunity from the outside, it's how can we elevate and really showcase our talent? So that is one of them, because I think federally qualified health centers, particularly us, we're advanced in many ways. And so we were able to do this research study that really elevated San Ysidro. And I think that that's the beginning of many things, that with the belief that we can do it and the talent around the room, is that we get organized and that we start elevating ourselves in places where we have not been before, because we need to showcase in the times where we're in tough turbulence with our government. We're in tough, turbulent times. And when we feel like we're being dismantled in so many ways, here we are rising and showing our value and showing our commitment and showing that we're not moving and that we're here to provide the services with high quality, with pride, with compassion, and that we are fulfilling our promise of our mission.
Yeah, I was thinking about commenting on that, but that's so well said that I'm going to leave it there because I've seen you as a leader, and it was a privilege to learn from you, talk to you, and discuss all these complex ideas with you over the years. And again today, I want to thank you, Veronica. It's been a pleasure, and I know a lot of people are going to get a lot out of this discussion.
Thank you for inviting me, and I look forward to seeing you soon.
Absolutely, thank you so much.